You know, several of us today have acknowledged that this place, the place that this is today, started when America was a British colony. But it started with a purpose that I think is pretty close to its continuing purpose. 1773, Baltimore had 10,000 or so people. It was a town, but there were what were referred to as vagrants and vagabonds, who were regarded as a problem.
And so they enacted legislation that ultimately stood up what we would think of as an almshouse on the west side of what was then actually a part of Baltimore County, today part of Baltimore City, on the site that today is University of Maryland Medical Center Midtown. That's where the original almshouse was located, on the west side of Baltimore.
And it was said from the get-go that there would be a physician at that almshouse. There would be a caretaker. And I presume originally it had a farm, but we'll get to our own farm a little bit later. Can I just read you a brief item from the 1821 document? Is this a good time for it?
Yeah.
Good. So Dr. Douglas Carroll discovered a wonderful history of the first 30 years of the almshouse from 1773 to about 1816. And the man who really was one of the first trustees, and I believe even had the idea that Baltimore should have an almshouse, was a man by the name of Thomas W. Griffith, born 1767, died 1838. Griffith, this is following his bio, Griffith then went to live in France, where he witnessed the French Revolution. At first, he was sympathetic with its aims, but as its course became more violent and tyrannical, he began to help members of the nobility escape. He was imprisoned for 2 years in Paris for these activities. After his release, returned to America. Now, this is about the almshouse. Doubtless with the French Revolution in mind, Griffith justified public charity largely in terms of its stabilizing effect upon the poor. He believed that relief should be left in the hands of experts like himself rather than casual givers, and so on. So he had embraced the idea of a constitutionally founded society that extended help to those who needed help. And he picked that up from the best sides, the best aspects of the French Revolution.
In the 1820s, the original almshouse was replaced by the acquisition of the Calverton estate, which interestingly was a little bit further to the west. But the Calverton estate was a more substantial physical facility and afforded the opportunity to care for more individuals. In the 1850s, Baltimore City and Baltimore County became very well-defined separate jurisdictions. Baltimore City fathers, the councilmen, decided to acquire a larger replacement facility on this side, on the east side of town, on this very site where we stand right now, and ultimately leading to the development of the first major physical facility on the site in 1866. And that was named the Bayview Asylum because it was a place that was receiving persons who were mentally ill as well as physically ill.
This place was self-sufficient. They had vegetable gardens, but there were 30 milk cows and there were 2 bulls. So I suppose that the bulls were causing calves to happen. So it was a very active farm. I believe that the place literally sustained its nutritional needs with its own farm. And when I came here in 1970, the barn from the farm was still down there down behind the NIH building.
Very interesting to me that as early as 1885, the first professor of pathology at Johns Hopkins, Dr. Welsh, began to spend time here because the Johns Hopkins Hospital was not yet finished. It opened in 1889. And so in 1885, he was here trying to find the opportunity for trainees to have access to patients. So the relationship with Johns Hopkins literally goes back to 1885, which I think is quite interesting.
As soon as Hopkins Medical School opened in 1891, medical students, as well as members of the medical faculty, Hopkins and Maryland, would come and would learn about patients in this building.
Hopkins and the University of Maryland, in the early days, the early 1900s, began to pay attention to what was going on here. And a very well-trained physician by the name of Boggs, Dr. Boggs, became the head of the Department of Medicine. He had been trained under Osler. He went through the training program in internal medicine at Hopkins, which in those days was a program in which trainees spent up to 10 years of time. And so he was well-trained, came here, and then a Dr. Shipley in surgery came from the University of Maryland Medical Center to serve as the chief of surgery. And that was 1911 and started an era which for the next 45 years or so would be one in which Hopkins would provide the leadership for medicine, and University of Maryland the leadership for surgery. All the time going forward in the history, what was fascinating to me is this perpetuation of a caring institution that was very community service minded, but also one that began to facilitate very significant teaching, training. And with that, when you have an environment where you have a lot of trainees, innovation occurs. So there's a rich history of innovation here at this institution. Any one of a number of things that could be cited. So, for example, the very first intensive care unit in the country was developed here. Mouth-to-mouth resuscitation here. Oral rehydration for children developed here. A number of innovations in surgical care. I believe the first renal transplantation was done here. Minimally invasive techniques for transplantation developed here.
Coronary care unit, the first coronary care unit was here. Hemodialysis got started here. The burn unit got started here. When we get to education, we can say the general internal medicine residency track and the associated faculty development program for clinician educators came alive here.
There are only a handful of institutions that exist in this rarefied space of having been involved for 250 years of continuous healthcare service. This institution is very special, not only because of the years of caring and community service, but because it enjoys this unique stature as an institution that has had the best of community hospital and the best of academic medicine together, providing this, as I mentioned earlier, this synergistic effect that is very special in terms of what then happens to the care that is rendered to patients.
I honestly think we can go all the way back and say at 250 years, we haven't dropped the ball on that strand of DNA that we've been talking about. I think it's really key that 2023 be a time for fireworks, and remembering that we're still doing what a small asylum or small almshouse set out to do in 1773.